we implant the pacemaker. How we implant pacemaker? This just outside we put the battery, and then battery have wire going to the atrium. How we bring this wire going to here without open the heart? Just easy. First, we know that vascular system have two things. They are the artery, they are vein. And then the aorta, we can open from your femur, from the leg, open only around 1 centimeter. And then 1 centimeter, we open that, we find your vein. And then vein can guide the doctor, the cardiologist, bring that wire. And then after that, going to the vein cover and up, and then until you get the atrium. Because the vein cava means the pembuluh darah besar balik. Dia akan berujung di atrium. So that after we bring that wire, and we can implant in this side. Do you remember that previously I told you that they are the conductive system, atrioventricular nerve, that can directly, we put the wire over there, and then after that, the wire will connect to the battery outside. Then, from the battery, we have specific program, can control, for example, maybe 60 times or 80 times per minute, heart can walk. That's the problem, how to fix is the last step. And then, if that also cannot work, we have another choice, but this difficult choice. We open the thorax and we fix that problem in the heart, but this is very bad. Possible only 30% the patient can alive. 30%. Yeah, but this the final step. So that in the future, why I love the UC Irvine and many UC system, because he provides not only in the how to do treatment patient in the hospital, but the most important, how to create a new thing to help the people by many experiments, many research. We have $2.3 billion in this year to fix the stem cell, include the nervous system and then heart disease, to how to treat the patient in the future. In the future, we have the gene therapy and stem cell therapy. What kind is important for our life in the future? Why? Because use a chemical or drug have side effect. Use catheterization also have side effect, but not prevent very well. And then if we do operation, also make side effects very difficult. So that in the future, how to replace if the heart already, for example, the heart already ischemic and infarct, that cannot recover. It's very difficult because like your hand have cicatrices like this. For example, you have injured in your hand or your skin, and it's difficult to recover because have the cicatric. We say cicatric. Also in the heart like that, it already kicked but still have problems. How we explain, how we treat later by use stem cell. We prepare the model heart and then later if that implant in the heart, that in the future. But this still a long way how we use that. But many gene therapy and also stem cell already usable for thalassemia, for leukemia. That also belongs to them. Because use the chemotherapy is very, I feel maybe only 10% can recover But if we change that, all of the system will better. But we cannot do like that for human, because human is alive, not like the robot. We just change battery, we change. It's different, right? So that future thinking about doctor about the stem cell. Stem cell is a future medicine. And we are happy. You see, Irvine get the $2.3 billion in this year. That's a lot of money. Next, I want to speak about how to prevent if you already have problems and the patient is heart disease, and then we are the human, we want to help the people. This for American Heart Association video, maybe you can hear. This movie. Okay, just listen.
The initial assessment, followed by cycles of compressions and breaths. Watch carefully, because you'll get a chance to practice all these steps together soon.
Sorry, you okay? Sir, can you hear me? Mike, is that responding?
Okay,
This one we say the cardiac pulmonary resuscitation. Everyone should be understand how to train, because as you know, we have only around 3 until 5 minutes to help the people during that condition. Before 911 coming, people will dead. Before that, our responsibility to our neighbor or our friend have disease like that. Just very easy to do it, but very important.
6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. One, two, three, 4, 5, 6, 7, 8, 9.
Yes, the meaning, only 2 things very easy you can do. First, if you find someone directly go down and not breathe, means only around 3 until 5 minutes, that condition. If no, the people will dead, the person will dead. If you exactly beside of him or her, you have responsibility to help, very easy. 2 things. First, blow the wind to the mouth, and the second, give pressure in the back. How many times? 30 times the pressure and 2 times the blow. If you can do maybe around 5 minutes, they can recover, but still have problem. After that, 911 coming and help. You can save the life. But I don't know, because another thing someone maybe don't know or maybe don't want, just say panic and death. Okay, if something like that, we can do also resuscitation after that.
now let's do.
2, 3,
The second step,
6,
the same thing. This depends on from the loyal.
The second rescuer should activate the emergency response system if he or she is not EMS and get an AED. Help is on the way. In 2 rescuer CPR, each rescuer has specific roles. The first rescuer performs chest
We do this one in the hospital, but
The second rescuer
your
maintains the
job,
airway and gives breaths.
the first step,
The
very
compression rate
important.
for 2 rescuer
Before the
CPR is
people dead.
approximately 100 compressions per minute. The compression
What's difficult to
ratio
press?
is
Very
30.
easy, right?
Compression should
But
be
that's
applied
really
giving
very
patients
useful,
time
very
to advance
valuable
airways in place.
before the people dead.
When performing CPR without an AED, rescuers should switch roles every 2 minutes to prevent fatigue. This switch should take less than 5 seconds, minimizing hands-off time. Rescuers also need to assess.
Okay, Then another thing I will show you. Also, this in hospital we do.
CPR
We
is
use the trachea
different
only,
when a victim
going
has
to
an
the
advanced airway, such as an
airway,
endotracheal
airway, and then
laryngeal
can
masked airway implant.
like this. This is the same thing, but
Two rescuers no
this we
longer
do in the hospital. And then next is the last point is prevention from heart disease. This is most important. This is our thinking today about the prevention. Because I think you are not going to treat the patient, you are not going to give your operation to the patient, but today is you're going to prevent yourself.